Hello, Dr. Rob McCartney from the Healthy Life Advisory Board. I've just been looking at a new AI-empowered health application. There's many of them out there and I have a real interest in this. I think it's important though that we understand what are the strengths and the weaknesses, the threats but also the benefits of them. And we're going to have a chat about that today. Okay, let's look at the good things. And there are good things. It's an amazing time for medicine with some of these AI-informed apps. Accessibility is one. I've got 4 boys who are constantly injuring themselves and getting a little bit crook. And trying to get access to healthcare when you want it isn't easy in Australia, as we all know. These are readily available. They're also continually improving, which is good. And medicine is getting so complex, the change in the number of medications out there and the way to treat things. If they keep up to date, these AI health applications can be really useful to get some information quickly and to have it specifically help us make some decisions about our health. But they're just an adjunct because there are problems with them. And we're going to talk about them now. The problems with these AI health applications is they don't know you that well. And so they're giving information based on the evidence across a whole lot of people, often all around the world. That doesn't necessarily apply to you. And even if you give them lots of your medical history, the complex nature in where that interacts, they're not quite there yet. And there are these things called hallucinations where they might give you some information that meets their needs for what seems logical, but could be really harmful to your health. And we are seeing more and more articles coming out now of some really bad outcomes for individuals who have followed the advice on these and came a cropper. Quite serious complications. So it's really important we realize the problems are it's not that focused, they're not necessarily up to date, and of course, because they're just an application, there's not even a board that oversees them to make sure the information they're giving you is truthful, factual, and safe. As a doctor, if I give you information, I'm overseen by AHPRA, by the Medical Registration Board, by my colleagues. While they are getting better and they have good things, I think overall it'd be quite risky for people to just use that for their healthcare. By all means, use them to get some background information, to get a better understanding perhaps of your symptoms or even your disease. But I would strongly recommend that you maintain that relationship with your primary healthcare provider. And everything you do should always be with that advice from them. You and your family need your family doctor. You need other sources of information. Augment it with this. Take this information to your doctor that you saw in these AI-informed bots or applications. Talk to your doctor about them. We're not anti it, but it's really important that you don't think it in and of itself is going to look after you. It's part of the way we're going to lead our healthy life, but it's not the only way.